So we're going to open it up to the panel right now, and just let me check to see real quick if we have any questions. Excuse me 1 second here. All right. So no questions at the moment, but I have a couple questions. So for the students in the group, how did you get involved in this major? How did you decide that this was the field that you wanted to go into? And we'll start with Jordan.
Hello again. So I originally wanted to do occupational therapy because that was pretty much one of the only things that I knew, and I thought I'd really enjoy it because you're helping people. Until in high school, one of my best friends was diagnosed with cancer, and he had a tumor the size of a fist in his brain. So when it was removed, he had to go through speech therapy, and he introduced speech language pathology to me and told me to research it, and I had learned so much about it, and I fell in love with it.
Excellent. Okay, good. All right. Emma.
Hey, TK, we have a question in the chat.
Oh, yeah. Oh, I apologize. Let me see here. Is this for graduate school? No, we are concentrating on the undergrad program for speech pathology and audiology. So again, just to be clear, we do have the bachelor's, the master's, and the doctoral program. But tonight, we're just specifically concentrating on the undergrad experience as it relates to a prospective student who might be considering Bloomsburg for this program. Okay. Em, go ahead.
So growing up, I always wanted to be a teacher. I knew since I was young, like that's what I wanted to be. That's what I wanted to do. So luckily enough, with my great parents, we got me into a vocational school that had a program for teaching. So all 4 years, that's what I was doing. I was focusing on becoming a teacher. But my teacher at the time actually had a guest presentation, which was a speech language pathologist. And her presentation was maybe like 30 minutes long, and I couldn't even get halfway through without wanting to be exactly what she was. So finding out about like speech language pathology my sophomore year was the greatest thing, because it was like teaching, but it also had a direction, and it was something specific, which I knew was like the best of both worlds. So I was really fortunate to know very early on that this was what I wanted to be, and have stuck with it ever since. And here I am, junior year. So
There we go. The origin story. I like that. Okay, great. And you have some special people in the audience. Do you want to say hello real quick?
Hey, Mom. Hi,
Okay,
Dad.
good. There you go. There you go. Good. Michaela, go ahead.
Okay, so I'm complete opposite. I had no idea what I was doing all through high school. Everybody's asking you, what are you doing in college? I don't know. I went to many different college tours, stuff like that. Just really didn't know what I was doing. I got accepted to Bloom through the general studies program at first. And then I was sent some information about this program from one of our secretaries. Shout out to Gay Ann. She sent me information about it, and I was like, this is really something that I could see myself doing for the rest of my life. So I applied for the program, got accepted, and here I am 6 years later.
Okay.
Really
Great. Yeah. And again, we're happy to have you, Michaela. Thank you. Jen, go ahead.
Yeah, so for me, all throughout high school, I had like just a love for like English, like whether it was reading, writing, like I just loved like grammar, like that aspect of it. And so I was like kind of looking at doing like journalism or like writing. Like I didn't really know what I wanted to do, but I also have always like since I was like 8 years old, always wanted to be like bilingual. Like I love learning languages, so like I was always like super into Spanish and everything like that. And then there's also like the other side of me that's like very extroverted. Like I love working with people. I cannot just like sit behind a desk all day and just like stare at a computer screen. Like I need to work with other people. So my mom actually works in a school as a paraprofessional, and she works a lot with like the speech teacher that's in there. And she said, hey, like you should really check out speech pathology. I think I was like a junior in high school at that point. She was like, I think you would like it. And I was like, no, Mom, like I'm gonna be a journalist. I'm gonna be a journalist. And she was like, no, like this would be perfect for you. Like you would get to work with like bilingual kids. You would get to like work with the grammar, with like the syntax and everything like that. She was like, you would love it so much. Like just check it out. And ever since then, I like watched videos on it, I did research, and I just fell in love with it. So shout out to my mom for that, for sure.
I was gonna say, yeah, Mom always knows. I mean, moms are never going out of business. So okay.
I know.
Right, good. That's a good business to be in, momming. Okay, great. Thanks, Jen. So what confirmed, like what was your aha moment where you were like, you know what, now this is definitely the path I want to go into, you know, for there's a small percentage of people out there that they know that they've wanted to be a teacher since 4th grade, right? But that's definitely a minority of people, okay? Very few people would fall into that category. So what was the point when you were an undergrad at Bloomsburg, you know, maybe it was your first year, your second year, where you said, you know what, this is exactly what I want. I'm glad this is the program I went into. And we'll start with Jordan.
So one thing that's great is I believe it's your sophomore year, you do a clinical observation class, and you get 25 hours towards your ASHA hours, and you get to watch different videos, and you go out and you shadow speech pathologists or audiologists or anything. And I got to shadow a speech pathologist in the schools as well as at Devereaux, which is a center for children with disabilities. And I absolutely fell in love with it. So that experience was a really great experience. And that also made me get a special education minor as well. So it was really, that was
the moment.
yeah.
Great, thanks. Em.
So like I was telling you, that guest presentator who came to my school in high school, I actually got in contact with her right after the presentation, and from sophomore year till my senior year, I observed her every single summer. So I was able to like kind of go under her wing, and it was honestly the best eye-opening thing I've ever experienced in my life, just like being physically in the field, obviously learning my way through it day by day. But then coming into the Bloomsburg program, I would have to say too, with the clinical observation course that we take, you have to get a certain amount of hours within your career at Bloomsburg to get into your master's program. And after completing those hours, it's just very eye-opening. It's really nice to be able to get hands-on like work once you first get to Bloomsburg, and seeing all these different audiologists and all these speech pathologists. And I think one thing I like to mention too is that once you get to Bloomsburg, up until your master's, you take classes in both audiology and speech pathology. So maybe you really are hardcore set on being an audiologist your freshman year. By senior year, you could go into speech if you wanted to. It's really, really nice and very tailored to both sides, which I think is really nice. Especially if I am going the speech path route, it's good to know audiology information going into the master's and into the career field as well. So definitely the experience with that you get at Bloomsburg helps a lot.
Yeah, so you're covering both bases there, so it gives you an opportunity to choose. And also, too, I think that the clinical experiences, it seems like it's giving you a glimpse into what the future holds.
Absolutely.
And it helps affirm what it is that you want to do. You know, you're not just living in the theoretical, you're practicing this in the reality, too. And I think, you know, for a lot of programs, there's definitely going to be some element of you know, man, I hope I picked right, because you're not going to, you know, you might not be able to do the hands-on experience or the internship until you're a senior. At that point, you're 3 years in, you know, so this is a nice program where you get a little bit of a teaser your sophomore year. Yeah.
Even freshman year too, to mention, you do have to get 10, you have to get 10 observation hours in audio and in speech your freshman year. So it's right off the bat when you get here.
And where did you do your observational hours?
Outside of school.
Yes.
I did them at a Care One rehab facility near me. I also, to the speech pathologist that I worked with was a private practice. So I was able to, with the permission of families, of course, be invited into their homes and see the observations as well. So I've kind of seen with patients who are very young to very old, which was super nice as well.
Nice. Okay, great. Thank you. Michaela.
Okay, so starting freshman year, we had an introduction to audiology course, and it was even hands-on then. We had different hearing tests that we did on each other. We had hearing aids that were brought into us that we could look at, manipulate, do whatever we wanted to. And I sat there during that class and I was like, wow, this is really something that I could see doing, like the hearing test, doing hearing aids, figuring out what's wrong with the hearing aids, stuff like that. And then even during the clinical observation class, when I did observe in private practices, I really just knew that this is what I wanted to do.
Sure. Great. Thank you, Michaela. Jen.
Yeah, so for me, my path looks a little bit different from all the other panelists, I would say, because I'm looking to apply to a program that focuses on like research. I'm really interested in doing like technology developments and just like conducting research to like help with the field. So my like aha moment was I took intro to audio and I was like, wow, like I really love this. Like this is awesome. Like I like it so much. And then I took Intro to Communication Disorders and Normal Language Acquisition. And I was like, wow, I really like speech too. Like this is great. So I was like, okay, now I'm really torn. Like I don't know whether I want to do audio or speech. Like what do I want to do with this? And then I remember I was sitting in class last year and I had to do a project about like something related to the speech field. And I was like trying to find research about it. And there was like literally nothing. Like I couldn't find anything about it. And I was like, wow, I could really make a difference just like doing research. Like there's so much that they don't know. I could help improve practice. I could help improve technology. Like this is something that I'm really passionate about. And the cool thing about that is that I didn't have to pick audio or speech. I can go get my PhD in speech and hearing sciences. So I get to work with like both fields still. So that was definitely my aha moment, that I could still work with both, still like combining the two parts that I love, but also like that's how I feel like I can make the biggest contribution to the field.
Right. And Jen, your biggest problem continually is that you like everything, right? So it's like so hard for you to narrow it down because you just like everything. You're just a happy person. And we
I know,
appreciate
but you know what? This major, you get the best of both worlds. If you go into research, you get to do them both.
that.
So, there you go.
There you go. There you go. And we do have a question from the audience from Ellen. And Dr. Cardamona, this is probably more geared for you. Can you please talk about how the speech certification works? Is it limited to PA or can you transfer it to other states?
No, it's reciprocal in other states. You could transfer it to other states.
Okay. Okay. Is it all 50 states or is it only specific states?
No, I think it's all 50 states.
Easy enough. All right. Great. Thank you for the question, Ellen. All right, let's see. So I know we have a good mix of students who are speech pathology versus audiology. Jordan, you were speech pathology, right? Okay. So why did you pick speech pathology versus audio? What was the point of differentiation there?
That's a good question. So I mean, audio, it's like sorry, excuse me, like Emma was saying, it's Bloomsburg is really good with providing both educational standpoints of speech pathology and audiology. I did really enjoy the audiology classes, but personally, I found more enjoyment through phonology and during my observations in speech pathology. But I have learned just in future reference, either in undergrad or grad, you do learn a lot. Like you use what you learned in audiology in your speech pathology classes, like clients to evaluate and everything. Like you talk about their hearing and all that stuff as well. But overall, speech pathology just really took to my heart. So I really kind of enjoyed the coursework a lot more.
Okay, so it was the coursework that kind of led you down this road. Okay.
Yeah, definitely. It's a little different. It's yeah, there's a lot of different treatments and stuff and different angles that you can take when you're treating somebody that we learned. And yeah.
All right, great. Thank you. You were your speech path for now, right?
Speech path. Yeah.
Speech path. So why
I would
speech?
definitely say, you know, kind of what Jordan was saying, you take all these courses, like I said, tailored to both sides. And then towards, probably about junior and literally up to the last point of when you're applying to grad schools of what you want to do is when you really get to decide what you want to do. But I just know from deep in my heart, since my sophomore year of high school, it was speech all the way for me. And, you know, doing all of the sessions and being able to work with kids, and I'd love to go early intervention. Old people make me cry, makes me really sad. So I like working with the younger population when working with speech. And I always just fell in love with the, you know, play aspect of, you know, children think you're playing with them. They don't think that you're doing an observation most of the time and that they get enjoyment out of it. And I get enjoyment as well. And I also love to talk. I can't not.
I can confirm Emma is one of our tour guide superstars. She does like to talk. That is very that's a fact.
Yeah, but that's why I really do enjoy speech path.
Sure. Great. Thanks, Em. And Michaela, I know you have a exam coming up here, so would you mind chiming in before you leave to go take your test?
Yes, sorry. I kind of already talked about why I chose audio more than I did speech, but I mean, I really enjoyed both sides of the classes all up to my senior year. It wasn't, I saw a speech class on my schedule and I was like, oh, I don't want to take this. I loved every single class that I took. I just enjoyed audiology more than I did speech.
Okay, real quick, favorite class? You're stranded on an island. You get to take one class with you to the island. What's that class?
I would definitely say intro to
Intro.
audio.
Okay. All right. And what year do you take that?
Freshman year.
Freshman year. Okay.
Dr.
Excellent.
Z is the best.
Who in Dr. Z, and is that the entirety of the last name Z, or is that short for something?
Zaleski.
Oh, Zaleski. Oh, yeah. Okay. Yeah, I know who that is. Yeah. Okay. Great. Great. And Jen, and by the way, Michaela, thank you very much for your time. Again, everyone, Michaela has an exam she has to go attend to. So best of luck, Michaela. Ace the test, and thank you. Jen, I don't know how you're even going to answer this question because you're going to do both, but I'll let you take a stab at it.
Yeah, so I kind of already talked about wanting to go into research too, but I'll also kind of like elaborate. So I am looking to apply to programs for grad schools that offer like a dual certificate almost. So I would go get my clinical master's in speech and then also work towards my PhD. So I am kind of like leaning towards the speech side, even though I am doing like both audio and speech kind of in the research. But like I said, I was really interested in both, and I thought research like combined that. But definitely like I thought it was a really hard decision to make just because I just found all of it so interesting. And also I feel like our staff and like professors are just like so good at making you interested in it. Like Dr. Z is like just such a passionate teacher. Like he's just like so amazing. Like he just wants to make you want to be an audiologist because like he's just like so like excellent at what he does. But then also my speech teachers like Dr. Cardamona and Dr. SG, who's one that I found was really good this year as well. They just make you so interested in like the speech side of things. So it was just a really hard decision to make. But all in all, I just, like Jordan kind of said, I kind of favored the more like speech side, like clinical side of things, like the treatment and like the kind of disorders that you would work with. So that's kind of why I chose to focus a little bit more on speech.
So in the program, is it like a team speech path, team audio? Is that what the breakdown is like, where like people sit on different sides of the classroom, or is pretty friendly relationship?
No, and I feel like all the time, like even people that are my year, I still like ask them like, oh, are you audio or speech? Like I really don't know. Like I feel like everyone kind of like seems just equally passionate about like everything. So
right.
Just to add in on that, me and Michaela have been friends since the very beginning of freshman year. So and we're still friends even now, even though we're two separate teams.
Right. I was going to say, yeah, it's like Eagles Cowboys there. Okay. So I guess it's a little bit more of a friendly relationship. All right. Good. Was there anything that everyone participated in high school, or that your average high school student might have access to, that might give them a general idea of what to expect? Maybe is it commonplace where you would take, maybe a biology class and it might cover some of the things you might learn about in the speech path program or the audio program, or maybe some kind of a volunteer internship, or any common locations where they might be able to work to get some experience with this prior to entering the program? And if the answer is no, that's perfectly fine. Okay, go ahead.
So not in my experience, not really. The only experience that I had was, I don't even know if they do this anymore, but senior projects. I did shadow a speech language pathologist, and I got to go into the nursing home. And then she also taught me like different stuff about video fluoroscopies, which has to do with swallowing.
Oh,
so
okay.
Look at like the physiology of the swallows. So I actually got to see that, and that was pretty much the only thing I got to do. But
still though, that definitely helps. Great, thanks, Jordan.
I know I said I really did do a lot before I did come to Bloom. The one thing that I would say is I don't really think there are many classes that you could take that would really tailor. But the one thing I can say is just, if you are interested in it, ask your school. You might have a speech language pathology gist or an in your school. Ask your teachers about it. Maybe you don't have one, but maybe they can get you in touch with someone that they know. The presentator that I had was my teacher's very, very good friend, and they grew up together. So you never know who has resources, and as my mom says, always network. So professors now and teachers that you had, always network and ask. It's never a bad thing to ask, because you might not know about it, but then once you know about it, there are probably so many resources that you could go to as a freshman in high school, up to a senior in high school, up to a senior at a university. So I definitely say, Brett, definitely reach out, ask your schools, ask your principal, things like that.
Yeah, you lose nothing by asking.
No, you don't.
Right. Great. Thanks, Sam. Jen.
Yeah, so I feel like speech path and audio are kind of like a mix of a bunch of classes that you might have already like taken in high school. So I
Okay.
feel like we learn a lot about like grammar, like because like people will sometimes have like disabilities that will like inhibit their ability to like use grammar properly or just like be able to like put those things together. So if you took like a structure of English class where you learned like a lot about grammar, that's something that we kind of like learned about as well. Like it's kind of incorporated. It's not like the main focus, but like it's definitely there. If you were like super into bio and just like learning about like the way that the body works to like help like you live, like that's kind of like related to speech as well. When you come to college, like you're gonna have to take anatomy and physiology, but of like the speech and hearing. So like it's kind of like more focused, but it still is like biology and like anatomy and stuff. So it's another class if you took like anatomy and you really liked learning about like the different parts of the body and just like physiology and stuff, like how the body works. That's something that's like really incorporated as well. The other thing I will say, because I really didn't have any experience with this when I was in high school, like I said, I went online and kind of like did a lot of research. I feel like speech is very like, or speech and audio, I have to stop saying just speech, but the whole major is like very visual. So like I feel like I'm gonna pick on like accounting for a second. Like if you were to look up like what does an accountant do, like there's no like you can't like watch a video of them like typing things into like an Excel sheet, like you know what I'm saying, like
Wow, shots fired. Shots, Dr. Shawver, I hope you're not watching.
But like there is videos of like people providing like speech therapy, or you could watch videos about like different technology like swallowing and like how they diagnose disorders with that. Like it's very visual, so there's definitely like a lot of online resources that will just really show you what the field's like.
Yeah, actually, that's a good point. Yeah, I mean, sometimes it's as simple as Googling something or YouTubing something just to get a preliminary idea. Yeah, that's a really good point. Were there any, or I guess, what are some of the characteristics that make a good speech path and audio student? Right. So if you're going into, I know Jen just took a shot at accounting, but like if you're going into accounting, obviously being good at math, being organized, being good at project management, those are all good characteristics of being a good accountant, right? Are there any good traits or good characteristics that you see in Dr. Cardamona? This is a great question for you as well. That consist of a good speech path and audio student. And Dr. Cardamona, we can start with you.
Okay, I think dedicated is one of the things I could really say. A lot of the students that we get in our program, they're very dedicated to the field. They join NISHLA, which is a nice student organization. They do an awful lot for the community and for the profession. They're also very they're regimented. They're studious. They don't fool around. They're very they really want to get the best grades possible. They're definitely type A. And they're genuinely, I mean, for me, because I actually worked in education. And for me, when I started to get speech pathology students, and I teach, and in my classes, I get a lot because I teach the ESL classes. So I get people from business, I get people from music, from here and there, and they're all good students, but I could always tell which ones are in our program, the CSD program, because they're just so dedicated to their studies and mature. And that's probably not that all students aren't mature, but I could tell, these guys, if they get an A-, they're going crazy. So, they're very, they're a wonderful group. They're wonderful.
I'm shaking her head profusely. Now, Em also knows her mom is watching too, though. So that's clearly the right answer, but okay.
They are. They're an awesome group. Awesome group of students. I've never really had a cohort that I didn't like. So they're great. They're great to work with.
Great. Thank you, Dr. Cardamona. Jordan.
Yeah, as many of you might know, that this field is very competitive in general. So, but even though it's competitive, you need to take a step back and think that you need to collaborate and work together too. In the future, when you're out, either in the graduate field or when you actually get a job, you will be working with a variety of professionals, occupational therapists, physical therapists, neurologists, doctors. You're going to be working with so many people and families. You're going to be working with people's families. So it is really important to know how to communicate with one another in like a respectful manner, in an appropriate way, and just become personable. That's a very important trait, I believe.
Right. It seems like the more personable you are, the better professional you are. And that's not necessarily the case for all professions, but it certainly is for a job like this. Great. Thanks, Jordan.
I would say for me, determination. There's going to be a lot of times where you're going to want to give up. Don't get me wrong. It's a lot of work and it's really hard. But as long as you have that mindset of determination and never giving up, I think that's the number one thing you can do is just be so engaged where, you know, if you get a bad grade on a test and you maybe you don't do so well at one of your clinical sites or so on and so forth, is that there's always different opportunities and different chances that make your determination so much stronger. It's a long time. You know, you have to get your master's to become anything in speech language pathology. You have to get your doctorate for anything in audiology. So you're going 4 to 6 years forward up, and even more if you go for your doctorate. I know I want to go straight for my doctorate as well. So it's a long road, but as long as you have that mindset of determination and keeping your mind right, that's really all you have to do. And I think that's one thing. If you got that, then you're pretty golden.
Yeah, that's a good point. Okay. Jen.
Yeah, so I feel like definitely one of the most important things I've seen is you have to be, I don't even know if this is a word, like broad-sighted. Like you have to be able to like think in the future, kind of like what.
Oh yeah, okay, I got you.
Or like open-minded and kind of like creative.
Okay, yeah, there we go.
I feel like when you're like working with a patient, they might like show symptoms of something, or they might like, a lot of times like speech and audio problems aren't like visual, like you just really can't see what's going on, and you kind of need to like take all the aspects and like diagnose them and create like a treatment plan and stuff. It definitely takes like a lot of, not like creativity, but just like kind of, because you do have to like put together something that is like specific to that patient that will help them the best. And that kind of is why I said like broad-sided, because what you're doing with that patient right then, they might just have like a 45-minute therapy session like 2 times a week or something, but like what you're doing with them is like impacting the rest of their life and their quality of life and everything like that. So I feel like you need to be empathetic, sympathetic, which one? I don't even know.
Empathetic.
You need to be empathetic enough to like realize that what you're doing is impacting their life, and like I feel like people that, if you just like have a passion for like caring about other people and you just love to like work with people and impact other people's lives, I feel like that's one of the main things that's like driven me throughout the major. Yeah,
it seems like at the core of what this career is, or what the program is, you're helping people, right? It's a helping profession. And it's not strictly about a diagnosis and a treatment plan, because you're probably not going to be able to get a simple diagnosis just by walking in and doing a physical observation, right? You're going to have to do more than that. And that's where the bedside manner, where the sociability, where the way you communicate with others is a really important part of this. And that's probably, I would imagine, is something that goes into being a good speech pathologist or audiologist, is the way that you're able to interact with your patients. And again, you're not going to have that with all the medical professions. It's not quite as important in some of the other fields or some of the other professions. So I think that's a good point. And it seems like you almost have to be part pathologist, part audiologist, part counselor in some ways, where you're also trying to work with families or patients that don't have a lot of familiarity with some of the things that they're dealing with. So I think, Jen, I think you kind of hit the nail on the head there. Yeah, great. So we have another question from the audience. This is from Shannon. Thank you, Shannon. Is it hard to get into the speech pathology program? All right, I think that's actually a question I'm able to answer, shockingly enough. So for the speech pathology program, it certainly is not easy to get into. Generally, the admissions criteria that we will evaluate prospective students on is predominantly your GPA and the courses that you took in high school. And this year we are test optional, okay? So we're going to weigh inordinately on your transcript, right? So we're going to pay close attention to how you did, especially in your math and science classes. Even though you might not be taking those exact classes in high school, that's generally a good way to judge how that student is going to do in the rest of their science courses or math classes while they're at BU. How you did recently right? So how you did your junior and your senior year. So recent grade trends is going to be important. And then the kind of classes that you took. So we're going to take a look at, were you taking cupcake classes, or were you challenging yourself and taking AP courses, or were you taking college prep classes? I would say those are probably the top three things that we're going to look at. Generally, students that go in the speech path, their GPA is around A to A minus, B plus range, but they tend to do well in the math and science classes in particular. Did that answer your question, Shannon, or is there please, if there's any other questions about admissibility or kind of how we're judging applicants for a program like this, please feel free to ask in the chat. I'd be happy to answer any of those. And Em, did you have something to say?
Yeah, I was also going to say, if anyone also has questions about the impact of COVID and everything that's going on and how our program, every single program at Bloomsburg changed tremendously,
Right.
Definitely feel free to ask about it, because times are changing and times have changed. So it's just very important to talk about. So
Yes.
feel free to ask those questions too.
Yes, absolutely. Absolutely. So the final question that I have for the night, favorite class and why? Jordan.
Oh, let me think about this. Oh, I know. My favorite class, Dr. Cardamona, I'm sorry. I mean, I loved your ELL class, which you're, okay. So, I mean, actually, Dr. Cardamona's one of her ELL, I have two favorites. So one of her ELL classes was one of my favorite. It was cultural awareness, and it really it kind of showed you different cultures and stuff, because you're not just going to be working with students who are just from the US. Even like there's a lot of students that come around from all over the world that have maybe moved to the US. So you need to learn their cultures and go along with them and respect everything. And she taught us that, which was an amazing thing. And then also phonology. I loved my phonology course with Dr. Scarpino. I absolutely love it. Even in grad school, we have a phonology course, and I loved it even more. So that was definitely a very cool class for me.
Okay, so I know what phrenology is, but I just want to make sure you know what it is. Okay,
Okay.
What is that?
So phonology is like a phoneme is a sound. So we actually write, our sounds are represented in symbols, which is not different. So like the just sound, you don't write a J, you write something different. So when we evaluate somebody, we actually write down how the sounds are supposed to be represented.
Wow, that's interesting. Okay.
It's a whole other language, kind of, in a way. Like, it's called the International Phonetic Alphabet. So it's really, really fascinating. And
wow.
That just helps you also when you're evaluating like articulation kids. Like, you could be like, oh, he's making a certain sound instead of what he's supposed to be doing. So that's how you do that.
Gotcha. And you really stuck the landing there too by working in Dr. Cardamona's as your co-favorite class or something like that. Yeah, I noticed how you did that there. That was well played.
Thank you. Thank you.
Yes, yeah.
I have three.
Three. Oh my. You only get there's only room in the suitcase for one class while you're on the isolated. Okay.
There's three.
Okay, there's three.
One of the first classes I had coming in as a freshman was Intro to Communication Disorders, and I had it with Miss Lawton. I loved that class just because, like I said, in high school, you might not take classes, that really tailor to speech language pathology or audiology. But when I took that class, that was like a definite for me that this is what I wanted to do, because it talked about everything that I wanted to know, from where you could go for any kind of job setting, like people you could work with, all different types of disorders and how they form, so on and so forth. And I think that was just kind of like a wow point for me, because I was like, these are all the answers to all the questions I wanted to know. Another class, I loved Dr. Z's Intro to Audiology class. He is one of the toughest but most rewarding professors I've ever met. He's that kind of professor that, has a PowerPoint, but gives you everything you need to know through his knowledge. And it's not just right off a slide. Like, it's a beautiful way to explain like things in his department in audiology. And it was just a really great thing. And then the last one was definitely phonetics, yet another challenging course for me, but was so rewarding, because it's crazy how you have this backbone of your language and your speech
Right.
that you never really know about. You don't think about when you say it, like when you make a sound, like, oh, that's actually a thing in IPA, like that's like a phoneme. Like you don't really
Sure.
think about that stuff. So it's kind of like the breakdown of everything. So those are my 3 favorites, and I really
Three.
love all the classes. I really just don't have complaints, to be honest.
Okay, great. Thanks, Jen.
Yeah, so I'm gonna have to kind of piggyback off of Jordan and Emma because I also have 3 favorites that I will say. My first is my first is definitely phonetics. I loved it. I thought it was so cool. Maybe that's just because I like to like learn other languages, and like Jordan said, it is kind of like its own other language, and it was like just so cool. And I also thought Dr. Scarpino kind of went into like learning about different dialects in the U.S. And I thought that was really cool because like we learned how like the phonology changes based on like where you live, like in like Boston or like in the South. Like it was like really different. So I thought that that was like really, really cool. Like I was like so excited for phonetics class. Like I just loved it. Like it was like so exciting for me. And then I also would say I loved intro to audio as well. And maybe that's just because Dr. Z like did push me so much. And now even in like my senior year, like I still know everything from intro to audio because I literally like studied my butt off for that class. Like it was so hard, but like he like made it like so rewarding. Like Emma said, like it just like it felt so good to just like know the material so well. And I also just like love the material. Like I thought it was really interesting. Then my last class that I'll mention that's different is Psycholinguistics. So I'm currently taking it right now. I'm not even finished it yet. Like, and it's one of my favorites. I think it's so cool. Our professor this year is new to the university. Her name's Dr. SG, and she's awesome. Like I love learning from her. I think she's, first of all, so like interested in what she's teaching that she just like pushes it out to her students in like a really meaningful way. And also maybe it's just because I like to read research, and like I'm kind of like a research nut in that way. But
of course you do, right?
But I think that it's so cool. Like so psycholinguistics, I guess I should explain it. It's kind of like how your mind thinks about language almost. So it's kind of like how your mind like produces language. So like even just I was listening to her lecture yesterday, and she was talking about how like why words like go on the tip of your tongue and you can't quite think of them, but like and we're like learning like the science behind like that's so cool. Like I've always like thought about that, and I'm like, why does that happen? And like I'm literally learning it. So I just think that that is so interesting, and I'm not even done it. I'm only halfway through, and I love it so much.
So I'll have to, maybe you can explain to me why I have 2 kids, a dog, a cat, and a wife, and I have to cycle through all of their names before I get to the right one. Is there like some kind of scientific explanation for that, or is there a fix to that?
I don't know. I would maybe just like spend more time with your family. Like I don't know.
I mean, it's in the middle of a pandemic, so we're spending a lot of time together. All right, great. Thanks, Jen. Actually, though that is a good follow-up question. What does the normal workload look like for this major, right? So
can I interrupt you real quick? We do have a question in the chat.
Can I answer that one?
Yeah, sure. Let me see. Is it harder to get
answer it as well because it's currently giving?
Yeah, and it just happened to me too.
Yeah, let me just pose the question so everyone knows. So, is it harder to get clinical hours during the pandemic? Which is a phenomenal question. And Jordan, sounds like you've got something to say.
So, I mean, I know this is kind of graduate, but I feel like this is how it's going to be for undergrad too. It was kind of difficult, but being in Bloomsburg, our supervisors have really helped us get these hours. We have moved over to Zoom. I have so many resources when providing teletherapy and gaining those hours because the supervisors have worked in a crazy amount with the school districts and clients and trying to find ways that we can provide therapy online so we can get those hours, because that is one huge thing. Your hours are so important. Hours are big. Even for undergrad, grad, you need to get your hours going because you need a crazy amount.
Yeah, and that's where the reputation of the program can really help too, right? Where the reputation of our speech path and audio program is outstanding, so it's going to help. Great,
Sorry,
thanks,
I didn't mean to interrupt you.
No, I'm glad you did.
And I
know I wanted to jump at it too. I was like, I want to answer this one.
Go ahead. Yeah, Em, take it away.
So also too, it kind of goes on with the next question that someone asked as well in the chat about if you have any observations freshman year, does the professor provide them or do you have to research them? So like
very good question.
Going A lot of the times you can take these hours when you're at home or when you're at Bloomsburg. So depending, it really is up to you. There are so many resources online just to look up, certain places that you could want to go to. But during like times right now, like I'm really trying to get an internship, and I know I really probably don't really need one right now. I really want one because I just want to be able to do something in my field. I don't like sitting behind a computer all the time. Right now, I would have to say it is pretty difficult. A lot of places are very scarce to find because of COVID. And I have reached out to multiple of my professors asking if they have any resources or know anyone that's accepting to please let me know. And honestly, they have gotten back to me, and they will definitely be honest. And even though they don't have anyone right now, I know if I ever went back to them when times maybe get a little bit easier to find something, that they'll tell me when I ask. And I think that's a really helpful thing. And another really, really great thing about Bloomsburg too is that during our clinical observation courses, when you take that your sophomore year, I had that last semester. And due to COVID, we were in it for what it was like half the semester, maybe. We were
about that. Yeah.
And then we went home. The greatest thing that ever happened was this thing that we use. It's called Master Clinician, which actually is free to the students with your professor. So it's really nice. It's this really great thing where there are probably thousands, correct me if I'm wrong, but thousands of videos on audio and speech pathology, like actual sessions and lessons that you can watch. And that's how I gained the rest of my 30 hours in that course, was through Master Clinician. And it was really, really great because all you had to do is your teacher would assign you the videos to watch. You would watch them and answer the questions like you would at any actual field, out in the field. And I actually really liked that because as if you're going to do observations and stuff like that, you're at the same place maybe for a couple days and stuff. But this one was a different therapist each time, a different child each time, a different child with different disorders each time. So it was something new all the time, which I thought was really eye-opening as well, because there were so many opportunities to see different kinds of children or adults, teenagers, so on and so forth, with different disabilities, and having a therapy session and just watching it, from my computer. So Bloomsburg was really able to adapt to having those kind of clinical hours in multiple ways.
I wanted to add something.
Oh, I'm sorry. Go ahead, Kim. Yeah.
We've also taken great strides in ensuring that the clinicians are safe from COVID. We've put protocols in place to protect. We worked really hard this semester to protect our the clinicians, the patients, the supervisors, the faculty. We've done a lot. It was a long haul, but it was worth it because otherwise they would not have been able to get their hours, and it's really, really important for them, especially in their at the graduate level in their second year. They have to get those hours, and there were a lot of roadblocks, trust me, and we to get through them and remain safe. That's the most important thing.
Yep, absolutely. I mean, the sad reality is that some of these health problems, whether there's a pandemic happening or not, people are still going to have these problems, right? So, we're going to need clinicians, we're going to need speech pathologists and audiologists that can help treat patients. And so again, there's an underscore of importance on this field. There's no question. Jen, did you have anything to add to the subject?
Not too much, but I was in Emma's clinical class where we had to move on to Master Clinician. And I will say that I thought that I was kind of bummed out originally because I was like, ooh, how am I going to know whether I want to do speech or audio? I can't really go observe. I don't know what's going to happen. And I feel like they really adapted well with the whole COVID situation by using Master Clinician because like Emma said, there was just so many different things that are kind of rare that I feel like you wouldn't you might not see if you just go into a hospital. They were kind of rare capturings that I was excited to see and utilize those so I could kind of decide more what I was interested in. So yeah, definitely.
Nice. That's good to know. It's good to know. So my final question was, again, so what does the workload look like for a student who's in this major, right? What's your average day look like in terms of, right, I need to work on a research project and I need to get, prep for my externship and I have a research paper to turn in, what's an average week look like academically? Jordan.
So I probably am not the one to ask about.
Oh, okay. All right. Never mind. Moving on.
It is for grad school. It's a little different.
Right. So when you were an undergrad, I guess what was it like?
Honestly, I kind of don't really remember. I'm not gonna lie to you. I know it was
Okay,
it
you don't
was
remember.
difficult, but grad school is a lot.
Yeah, sure.
So I can't really tell you because I've already had the experience of workload in
Right.
grad school. So in comparison, I don't have a comparison.
So you're saying it only gets harder for after day one? Okay.
Yes, and I mean that in the best possible way, but when you really enjoy something, it doesn't, I mean, it still feels like workload, but you still love it, but you're balancing classes and clinic and everything. So
Right.
it's a little different.
Right.
It's okay.
Right, you're right. And but again, it does, when we were talking about what makes a good student in speech pathology and audiology is you got to want to do it. You have to enjoy the subject. And you have to enjoy what you're doing in class and in your clinicals. Because if you don't, it's not a job that you can just collect a paycheck. I mean, you got to love it.
It's a passion.
It is. Yes. It's like, it's a way you live your life as opposed to just a job, Okay.
It's a lot. I mean, since coming into freshman year, you have to be ready for sacrifices. I mean, a lot of other students maybe on the weekend are like, hey, like, why don't we go to downtown and do this and like do all this stuff?
Right.
And you know what? You have to study or you have to work on the classwork.
Mhm.
And it's about the sacrifices. And what's nice about Bloomsburg is you can start taking some of your major courses like once you get to Bloomsburg, like you don't have to wait.
Mhm.
But as a junior right now, I'm currently taking 4 of my major classes and 1 of my minor classes. And
Right.
this was my work last week. I only have
Right.
free Saturday. So for my parents who are on here, yes, I do my work. And it's just, you have to be prepared. It's really just a lot, and sacrificing is definitely something you're going to have to run into and will run into when you get in here. But kind of like what Jordan was saying, it's so rewarding. Like the passion and everything that you find, it never really feels like work. And especially going into something that doesn't feel like work every single day is
Right.
a really great thing. And as much as I do miss in-person classes and things like that,
Mhm.
I still feel like workload either way is pretty similar. It's a
Mhm.
lot, but it's so worth it. And, you just got to keep fighting through it.
Yeah.
School is
Just
school.
want to add one more thing.
Yeah,
I'm
go ahead, Jordan.
sorry. Just as I know sacrifices are huge. You do have to sacrifice,
Right.
but just because you have to sacrifice doesn't mean you can't have fun in college too.
Right.
Before anybody gets all scared, I was in a sorority. I was in multiple clubs. I still managed to get a very good GPA. But there
Mhm.
are some things that you do have to sacrifice. Like Emma was saying, sometimes you can't go out every weekend. Sometimes you can't go home every weekend.
Right.
Sometimes you're up till midnight studying and
Mhm.
doing that kind of stuff. So no
Mhm.
wing night at West End. But it's one of those things where you can still have a good balance.
Right. Right. Yep. And that's definitely a good point. And Emma and Jen, they have they're also tour guides in our office. So I would imagine you have like, your major and your career, and then like up here is like being a tour guide. I would hope that's the breakdown, right? Good. You're shaking your head. Yes. Good. Yeah.
Obviously.
That was the right answer in case you were wondering. Okay. Yeah. Jen, go ahead.
So for me, I feel like I'll definitely have to concur with our other panelists by saying that I feel like I really like the work that I have to do most of the time. Like it can get overwhelming. I feel like the only reason that it's like hard is because there's so much of it, not because I don't want to do it. If that makes sense. Like, like sometimes I just have like 4 tests in one week and I'm like, oh my gosh, I don't think my brain can fit all this information, but I want it to, but I don't think it can. So like, I feel like it's definitely like a balance. And I feel like I definitely had to learn how to like time manage in college because I have always been an involved person. I'm an exec board of our student government. I'm a tour guide. I'm a tutor. I'm in the honors college. I'm a BOG scholar. Like I balance like a lot of things that are going on. Sorry, I can't even count that high. But so I kind of definitely had to I have to make a schedule for myself every week. I know that like this is a demanding major and I know that I need to study to do well in the courses. So I feel like just learning how to time manage, and like you might come in as a freshman and just like you might realize it's really, really hard, but you know what, like you're going to learn how to time manage. You're going to learn how to be able to do
Sure.
all of your work with success. So I feel like it's not that I like don't like studying for these classes. Like I do like it, but it's just like
Right.
it can be a lot at times just in terms of like workload. And I feel like the stress of like having to maintain like such a high GPA for like grad school applications also is like stressful, because it's like I can't let myself slip. Like Dr. Cardamona was saying, like we like cry if we get like an A-. Like that's definitely like me as a person. So I just like feel like I always push myself, but in the best way, because I just want to be like a successful professional. So
yeah, no crying, smiles.
No.
Smiles. Right. Yeah. So, so we talked about everything that goes into this major. Dr. Cardamona, could you talk a little bit about what students get out of this? What's the career outlook look like? What's general ballpark information on starting salary? I mean, they're making a big investment in time, because going to college is not free. So, what can they expect when they graduate with their degree? You're muted.
Sorry.
There we go.
They can expect definitely to be hired. I'm positive that we have 100% hiring, employment rate when the students graduate, and they can expect to make a decent salary, whether they're going into audiology, speech pathology, or IONM. And I think I mentioned previously that there was a gal who just recently sent me her resume to look at, and her monthly salary as an audiologist was like $7,500 a month. So
Yeah,
she was making really good money. And also for the speech pathologist, I would surmise that it depends on where you go. If you're going into a school or private practice or in a nursing facility or medical center, you could make, 65 and up. So the outlook is really good as far as salaries are concerned, as far as being hired. And because it is so limited, the graduate school, and competitive, it helps to maintain those positions. It will never become saturated. Right.
Yeah, because you figure there's not many undergraduate speech pathology and audiology programs to begin with, right? So just by that alone, like it's not, a program that every college in America has. So they're not pumping graduates out every year. So the career, it seems like the career outlook, the job prospects looks pretty promising.
Yeah, definitely.
Right. All right. Well, let me just make sure we don't have any final questions here before we sign off. Actually, we have another great question from Christy. Do you have to apply for a graduate program, or is there a preference to auto-accept criteria? So I think Christy might be referring to, do you have to apply for the BU grad program, or are you automatically accepted? And Christy, if I didn't get that correct, please feel free to correct me there. But Jordan, let's assume that's what she was referring to. Could you speak to that?
All right. Hi, Christy. So one awesome thing about Bloomsburg University is that if you go to Bloomsburg for undergrad, you might have a chance of getting conditionally accepted for both audio, well, not both, but like audio or speech pathology. So and it's based on your GPA. So if you are in the top 15 of your class for speech pathology or communication sciences disorders, but you want to go into speech pathology, if you're in the top 15, you automatically can get placed in the graduate program. If you get in the top 7 for choosing audiology, then you get automatically accepted into the audiology program. So Bloomsburg is one of the few schools, if not only one of the only schools that I know personally that does this. But just because, let's say you don't get conditionally accepted, that does not mean that you can't still apply to get into the program. So then you would just go through the traditional application. But it's a really cool thing.
Yeah. I was going to say, I mean, it certainly seemed like that's something, we give, seems like there's some preference given to our undergraduates because we know what they were doing while they were undergraduates. And I know we've had, our grads have gone on to Syracuse is one that comes to mind. Penn State is one that comes to mind. Let me think, Jacksonville University, we have a lot of students that go to BU. So yeah, every year we have students that end up going on to big time institutions if they don't choose to stay at Bloomsburg. So our students are prepared to go into any of these grad programs where they're looking at. So is it top 15% or is it the top 15 people?
Top 15 people.
Top 15 people. Okay, good to know. Christy, awesome questions. Awesome questions. So that is it. Any final thoughts before we sign off? I know. I'm sorry. Go ahead, Jen.
I was just gonna say, if you wouldn't mind, like, I just feel like this program has like, is so different from when I was looking at my different undergrad programs, and I'm a tour guide, so maybe like I'm a little bit like on my tour spiel right now. But like when I went to go visit other schools, I feel like I wasn't like, they didn't care if I had other interests, because like I am so interested in like linguistics and Spanish and stuff. And I went to other schools and they told me kind of like, if like, oh, if you're speech path, like you can't study abroad, you can't, like, we don't want you to have minors, double majors, nothing like that. And I came here and I met with the faculty and staff on one of the open house days, and I was like, yeah, like I'm looking to study abroad. They were like, oh, great, cool. Like we love when people like study like other languages. We love when people like do this, because it just brings such like an interesting perspective to like you as a professional. So I feel like just my experience like visiting other schools and then coming here, they were so open-minded and so ready to help me succeed here, that was just like really what pushed me to be a student here. So I feel like if you guys have like other interests, like you want to study like linguistics, you want to go into research, you want to study language, like BU is definitely the spot for you, because our staff and our teachers and professors are just so willing to help you make anything happen. So I just want to put that out there.
Yeah, well said. Jordan.
Going along with what Jen just said, obviously I love linguistics so much, I decided to go to graduate school here.
We appreciate that.
Yes, so it is so personable. You can go to their office hours. They have open arms all the time, which I really like that. It is you're not in big lecture halls. It's just really great. And one thing I loved was a lot of the professors in undergrad are also the professors in grad. And I loved that, because I mean, all the professors are just so amazing. So that was a really good experience, because they're also bringing their knowledge from graduate and seeing the graduate students' work and what they can give to us from that, if that makes any sense.
Yeah, they're bringing continuity too.
Yeah.
You know, so if you end up going to grad school here, you already know the faculty, right? You already have that relationship already established. There's no fear of walking in and, you know, knocking on their door to ask a question. And they know what's happening in the grad level, so they know how to prepare people for that, because you're not going anywhere unless you have a minimum of a master's degree, right? So they know how to prepare you to get to that point and how to be successful while you're there. Yep, that's a good point. Yeah, thanks, Jordan.
I would say definitely, probably, if any of you are like watching and are like, wow, this is a lot, like this is probably a lot, don't be afraid of it, because the outcomes are just so remarkable and are so worth it. I know I've probably said that like 15 times. It's fine.
Yep.
But don't be afraid to be open-minded to the possibilities, because we have one of the most flexible careers that you could ever think of. Wherever you want to go, you can be a traveling speech pathologist and go to different countries and go to different states and all this other stuff. You can work with any kind of age group. Maybe you don't want to work with kids anymore. Okay, I want to go work with like older adults. Maybe you don't want to be a speech pathologist anymore, but you want to become a professor and teach courses in it. Like, there's so many different ways and outlooks and routes. So yes, it's a lot of work. Yes, it's a long time. You're going to have to hit the ground running, but it's so worth it. And don't be afraid of it. I know we probably just talked about so much stuff, and probably researching it is also a lot too. But there's a lot of different things and a lot of great outcomes. No bad, just great outcomes that come within the field. So
it's a big investment, but it's big rewards.
Yes.
Yeah, and that's an outstanding point. Yes, absolutely. That's a great point to make. Yes, Dr. Cardamona.
I may learn to mute myself eventually. No, I mean, I look forward to having you come here, apply, take a tour. I know with COVID, it's kind of difficult, but we are doing everything virtually. So if you're interested, we're going to be having 2 open houses in the near future. And yeah, come and take a look. I think you'll be pleasantly surprised.
Great.
And admissions, we're still doing tours too. So you can come.
Bingo.
We're one of like the only campuses that are still doing like running physical tours. So please come.
And if you're lucky enough, Emma or Jen might be your tour guide. Right? Yeah, there you go. All right, everyone, thank you so much. We appreciate your time tonight. We hope you learned a lot. If you have any other questions, please feel free to follow up. We are happy to help. And really, throughout the course of this process, we work for you. So thank you, everyone, and have a wonderful night, and go Huskies.
Thank you.
And really, throughout the course of this process, we work for you. So thank you, everyone, and